Hey, this is Dr. Ben Whites, host of the Rational Wellness Podcast. I talk to the leading health and nutrition experts and researchers in the field to bring you the latest in cutting-edge health information. Subscribe to the Rational Wellness Podcast for weekly updates. And to learn more, check out my website, drwhites.com. Thanks for joining me, and let's jump into the podcast. Hello, Rational Wellness Podcasters. Today, we're having a discussion with Dr. Khalsa, a chiropractor in Los Angeles who has some innovative ways to treat his patients. So, Dr. Khalsa, or should I call you Dr. Hari or Dr. Khalsa?
It's Hari. Get it clear. It's Hari. It's
Hari?
Yeah.
Okay. Tell us about yourself. How did you get into healthcare? Tell us about your journey.
Well, I grew up here in Southern California and born and raised in LA, and didn't really have much knowledge of holistic healing when I was growing up. My parents were pretty much into Western medicine. I was kind of gearing up to go to medical school when I was in high school. I actually worked in a heart valve factory. My first job I was a tech in a heart valve factory.
Okay.
And I was in the return department, if you know what that means.
A lot of people complaining, right?
Well, a lot of people were actually dying.
Oh, okay. Yeah. I see.
Yeah.
I got it.
Most of my days were spent with court reporters and lawyers going over the damage that the surgeons did to the heart valve. They ended up stroking the patient out.
Oh, boy.
Yeah. That
okay.
was quite but anyway, I ended up going to the University of Oregon, and I was kind of a daredevil. Like, I don't know if you've seen any of those videos from like the 70s where the kids, kids in the 70s were pretty much like little daredevils. Like, I was exactly like that. I was like an Evel Knievel. I had like 3 major injuries in 1 year, and I'd never had any physical pain in my whole life. And by the time I was 20, I was racked in pain. And I was going to a yoga class, and the yoga teacher said, "Why don't you go to a chiropractor?" And I'm like, "What is a chiropractor?" I didn't even know what the term was.
Okay.
So, but that chiropractor fixed me up, and a lot more than the medical doctor who just wanted to give me drugs, which I just intuitively knew that I didn't want to take drugs.
Right.
So the chiropractic opened my eyes to the whole, holistic healing model. He was actually a chiropractor that was both a naturopath and a chiropractor. So I got to see the whole realm of naturopath and chiropractor, my very first doctor. And that excited me. I was very excited about, what he was able to accomplish with me as a patient. And so that kind of launched me into this whole world. That was 1980.
Okay.
Yeah. So I ended up going, and I liked that guy so much that I was like, I want to go to the school he went to. So he went to the Western States Chiropractic School up in Portland, Oregon. And
okay.
I didn't even look into the school. I'm like, that's my guy. That's my school. That's where my guy went. Didn't even look into anything about the school or anything. And that's where I went. And I quickly learned that when he was at the school, it was a chiropractic and a naturopathic school in one school. And they had divided the school into 2 schools, into national naturopathic and then Western States chiropractic. And I was a little bit disappointed because I really wanted the naturopathic along with the chiropractic. So I kind of had to learn all this naturopathic stuff that I do now on my own.
Okay.
Kind of like just, piecemeal, like going to different workshops, seminars, biohacking events, for the last, 44 years. I've been studying this stuff, right? So
right.
That's kind of my history. Yeah, a little bit.
Okay. Sounds good. So now you have this chiropractic clinic in Los Angeles. And how do you incorporate the naturopathic and some of the other natural healing modalities into your treatments?
Well, that's a good question. So, I got trained in AK, muscle testing back in the day.
Okay.
With Bersendahl. Do you remember that guy?
What's the name?
Versandol. It was standard process.
Oh, I heard the name. Yeah.
Yeah, back in the day, we're talking back in the 80s. Yeah. So I
Okay.
got a lot of training in that and, Touch for Health and, a lot of muscle testing. So I started my practice off doing that kind of technique. Although what I found is I started, incorporating a lot of herbs. I was working with all the different, vendors for, Apex Energetics, Standard Process, all the nutrition that we do as chiropractors, right?
Yeah.
Well, I kind of got burnt out on that. A lot of my patients, in LA, it's funny because we got a lot of vegans and vegetarians, and Standard Process is very heavy in the organ meats, right? So it kind of killed my practice, that side of my practice. So I was kind of bummed because I really like Standard Process. But anyway, I ended up learning from a naturopathic friend of mine about technology they use in Germany. It's called Cyberscan. It's on our website. You can do a deeper dive if you want. But basically, it's a biofeedback system. I pretty much like to start with my patients with that because it's like a full body analysis. It shows us all the underlying things pretty much as comprehensively as what I was used to doing with muscle testing. So I can identify all the organs, systems that are weak, if they've got pathologies, pathogens, toxins, deficiencies. We're looking for everything with the Cyberscan. So that's a really comprehensive test. And I always pretty much try to start with everyone with that.
How does that Cyberscan work?
The patient puts their hand on a plate and it generates a scalar wave, which is kind of a woo-woo quantum physics type term, but it's basically like a wave of energy. It's not EMF, though. That's the unique thing with the Cyberscan. It's not like a lot of these testing devices, they use electricity to run through the body, right? This doesn't put any electrical energy at all. It's a pure scalar wave, which is generated by a series of Tesla coils, a Tesla coil array. And so what happens when the patient puts their hand on there, the scalar wave the machine has the ability to actually capture the energy of that patient in the machine. And now that is the, what do you call it? The secret sauce of the Cyberscan, I'd say. Is like, how does it do that? To this day, I really don't even know. And this borders on woo-woo science, but one thing I can tell you for sure is the Cyberscan is extremely accurate. Like I probably tested over 10,000 patients in the last 10 years with the Cyberscan, and the results are, mind-blowing. Just mind-blowing as far as
so give us some examples. So patient comes in, they put their hand on this thing, and then what kinds of results might you get?
Well, okay, so just an example, I had a guy, let's see, what was their problem? Oh, this is a sad case, okay? Really sad. The guy, he had developed a duodenal tumor, okay, which was causing like a stenosis of the small intestine. So the food could barely get through, right? And so I scanned him, and literally the very first thing that showed up was a stenosis in the small intestine, and then it showed up the series of tumors and blah, blah, blah. And I tell the patients, this is not a medical diagnosis. All this
before he saw you, he didn't know about the tumor?
No, he knew about it. He knew about it.
Okay.
Yeah, but the Cyberscan picked it up on the very first reading. It picked up a stenosis of the intestine, and all the other different symptoms he was having. It picked up all the stuff. So that's just one example. But I had people who've had face trauma, head trauma. It'll pick up details of the trauma they had. It'll pick up underlying congenital heart problems that people know that they have, and sometimes they don't know. But I had a patient yesterday who knew that he actually had a surgery for it a few years previous to correct a congenital heart problem, and it picked it up. So it's very accurate. I have no idea how this technology underlying the physics of how it works, but I know this is that it does work. There's no doubt.
Give us an example of how this helped you to help your patient better.
Okay, well, basically, that's great because that's where we go with this. So basically, I go through this entire report with them, and we get the picture, the overall picture of what's going on with that patient, with their hormonal system, their respiratory, circulation, nervous system, musculoskeletal, all the different systems of the body. So they get a big download of, hey, this is what's going on with you, right? And then what I'll do is tell them, very specific things that they can do at home, like, detox protocols, vitamin, mineral supplements, depending on what shows up. Because, it could show up that they have a zinc deficiency or B12 or this or that. So they get all of that from their reading, right? Everything they need to know about their nutrition, detox. So
you ever follow that up with labs to confirm it?
If they do labs, I don't do a whole lot of labs, and to be really honest with you, I find the Cyberscan is way more accurate and more detailed than any lab that I've seen. It gives you way more information, and so to me, it's like, why waste the time? I mean, I get the data when I scan them. So, I mean, I'll look at their labs if they have them, but sometimes I'll do that, but it's rare. It's rare because the information is way more comprehensive on the Cyberscan. And then the other thing we do that we offer the patient, although it's not like a requirement or anything, but we make a remedy card where we actually put the frequency of their scan on the card. And then the patient wears the card on a necklace, and the frequency, just like a homeopathic, like if they were taking something orally, it's just working on the energy field of their body to help align or correct whatever imbalances there are. So yeah, that's kind of
okay.
That's the overview of it. I'd love to have you do it some point because you're here in LA. You could come by. I'd love for you to come experience it.
Yeah. Okay, sounds good.
But that's the core of the analysis. As far as other things, like I'm a big believer in PEMF, hyperbaric, red light as a.
So why are you such a big believer in PEMF?
Because, well, first of all, it's helped me more than just about any therapy I've ever done. But specifically the pulse PEMF. The pulse PEMF is the most powerful, high-powered PEMF. There's a big difference in a beamer or any other like lower-powered unit versus a pulse machine. A pulse machine, first of all, is like $45,000. So they're not cheap machines to start with, but you're paying for results and quality. So I got introduced to Pulse, I think it was about 8 years ago at A4M, and I got on a Pulse table. The first time I'd ever been on a Pulse table. No one was in the booth. I turned the thing on. Have you ever been on a Pulse table? Are you familiar?
I had somebody come by and I've had some demos at the office. One of them was this like oval thing that she put on my stomach.
Right.
I had another demo where there were these coils that you wrap around your arms.
Yeah, that was the original PEMF I was using. The Pulse, the one I have is a bed. It's a full-size bed that you lay on. And it's like a zero gravity thing. So it totally hugs your body. And it's pumping the PEMF signal through every cell of the body. So primarily what I tell the patients with that is that any disease that you're dealing with, at the root of that disease is cellular voltage. So if you can raise the cell voltage with a PEMF unit, you're taking that cell out of a disease state into a healthy state. So that's the.
But I mean, how do you know, let's say they have cancer, how do you know you're not going to promote more cancer growth? I've really been enjoying this discussion, but I just want to take a few minutes to tell you about a product that I'm very excited about. Imagine a device that can help you manage stress, improve your sleep, and boost your focus, all without any effort on your part. The Apollo wearable is designed to do just that. Created by neuroscientists and physicians, this innovative device uses gentle vibrations to activate your parasympathetic nervous system, helping you feel calmer, more focused, and better rested. Among the compelling reasons to use the Apollo wearable are that users experience a 40% reduction in stress and anxiety. Patients feel that they can sleep. Their sleep improves up to additional 30 minutes of sleep per night. It helps you to boost your focus and concentration. And it's scientifically backed. And the best part is you can get all these benefits with a special $40 discount by using the promo code WEITZ, WEITZ, my last name, at checkout to enjoy these savings. So go to Apollo Neuro and use the promo code WEITZ today. And now back to our discussion.
Well, that's a good question. When I did my training, and they, by the way, Pulse makes no medical claims whatsoever about this device. The only thing that they make a claim for is cellular exercise, basically working the cell out with magnetic pulse energy, right? But I can just tell you anecdotally, the guy who did our training when we went back to Atlanta to do the training about 6 years ago, he had just recovered from 4th-stage cancer. And the only therapy he did was the pulse machine. So there is some efficacy, and I think in the literature, it shows that it can be effective. Although I wouldn't.
Speaking of the literature, what kind of scientific studies are there on this?
There's a lot. Like if you go to PubMed and just put in, type in PEMF and in any condition you can think of, there's a study. There's over. Well, at the time that I was doing the academics on it, it was over 6,000. Probably now it's probably over 10,000. There's quite a bit of study on it. Yeah. So
cool.
But for just what I've seen with myself, there's not been one accident, injury, back, I'm talking even broken bones and different things that happened to me personally, where I did, where I got on the pulse machine and it healed me in like 1/3 the time.
Okay.
Yeah, so it's the heavy hitter. I'd say it's like it's like the forklift that gets people out of the trench when they're really down.
Okay.
Yeah.
So using this for musculoskeletal injuries as well as whatever else might be going on.
For like sprain, strain. It helps fractures heal in like a fraction of the time.
Okay.
The number of people with fractures, it heals much, much quicker. Yeah.
Okay.
Yeah.
Okay. So what's the next thing you want to tell us about?
Well, hyperbaric.
Okay.
That's another thing.
This is high pressure oxygen tank.
Yeah. Getting into high pressure. During the pandemic, I had a lot of time to do research because there was no patients. So I was just going down different rabbit holes, and I think it was I've known about hyperbaric hyperbarics for decades, but I never really thought about it as something I wanted to do in a clinical setting. But then I started seeing these studies that were done in Israel. I don't know if you're familiar with them, but they showed a 25% increase in telomere length.
Now, the only thing I would say about that is my understanding is they were using these hard tanks with really high levels of pressure, and you have to do it 40 times.
It's intense. You're right. It's actually 60 times.
60 times.
60
okay.
2-hour dives.
Wow.
But that's what they showed is that it increased the telomere length by 25%, which is like that. To me, that's mind blowing because I've been around the biohacking and this community, and the most I've ever seen, with supplements and things like that is maybe 5%. That's what the kind of the mean level of increasing telomere length is if you're using the high level stuff.
Yeah, we stopped running the telomere length years ago. We've been using the true age
Yeah, the true, that's way more accurate.
epigenetic,
Yeah,
methylation.
yeah. But regardless, there's a lot more other types of studies. That was the one that kind of opened my eyes.
Right.
But the bigger, I think the biggest study, and it's even true with the lower pressure hyperbarics, like what we use, the soft shells, is in 1 week, and this is an unpublished study. I got this from the owner of OxyHealth because they're going to probably release this study this year, but basically what they showed was it in 1 week in a soft shell chamber, you're tripling your circulating stem cells, tripling in 1 week.
Okay.
So
That's cool.
Yeah, that's pretty good. So, and we've seen really amazing results.
And these are 1 hour sessions?
Yeah, 1 hour. Yeah. But we've seen amazing results with a lot of conditions with hyperbaric. The most amazing one recently was this woman who had 50 years of chronic congestive lung issue where she couldn't get a full breath and her lungs kind of gurgled. And she'd been like that for 50 years.
Wow.
Yeah. And literally after 1 week of doing hyperbaric, she was also doing the red light and pulse, but I think primarily the hyperbaric was the key thing for her. Her symptoms went away in 1 week. It was unbelievable. I was like, we were like, wow, that's amazing. But we've seen like that, similar types of results with long COVID. People with long COVID where they just are flat out, they have no energy. And it takes a little longer, but like 20 sessions, they're back to their normal self.
So is it like rebuilding the mitochondria?
Oh, it's mitochondrial biogenesis. It's it's regenerating neurons in the brain. It's getting, increasing your, circulating stem cells. It's helping with overall body inflammation. It helps with it helps boost the immune system. So it's good for a lot of things, wound healing. We've treated animals. We had a cat that we didn't know the vets couldn't tell us what was wrong with the cat, but the cat literally was like fell over sideways. We thought, oh God, the cat's dead. And we just started putting him in the hyperbaric. He came back to life.
Interesting.
Yeah. So unfortunately, it doesn't always work though, because we had another cat that just passed away, unfortunately, but we didn't get to him quick enough. But they put him in hyperbaric in Florida. My wife's in Florida, and he was too far gone, I think. But it just depends, where you're at. But mostly humans do really well in hyperbarics.
Okay.
Yeah.
What about, I was just looking into, I was actually talking to somebody online about antioxidants and cancer. What about antioxidants and hyperbaric? Because hyperbaric is high pressure oxygen. It's oxidative stress. So you probably don't want to take antioxidants like right before or right afterwards, right?
Well, some doctors they incorporate methylene blue hyperbaric because methylene blue is an electron donor to the electron transport chain. So you're getting that mitochondrial boost, and then when you add in that extra oxygen, it's supercharging your mitochondria.
I wonder if you did like an IV vitamin C, would that also have a supercharging effect?
Probably. I mean, anything you do with it, but I think methylene blue is the big one that people are using.
Okay.
Yeah.
Yeah, I know a lot of people are talking about methylene blue.
Yeah. We use it also with a red light too. It also goes good with red light bed too.
So does a person turn red or blue?
No, your pee turns blue. Have you taken methylene blue?
I have not yet.
Well, when you take it, your pee turns blue.
Okay.
Yeah.
I know there's a blue man syndrome where if you take silver, you can turn blue.
Yeah, well, a lot of people's mouths, their tongue will be blue. I take a form of it now, which is in a pill that you can swallow it so you don't get the blue in your mouth.
Okay.
But it does happen, though. You can get a lot of them.
Yeah, I'm doing the urolithin A and the NR. I'm doing a ton of the and the longevity things. I haven't gotten to methylene blue yet, though.
Yeah,
That's probably
methylene blue is a
next.
good one. That's a good one. I like it.
I just added some of the plant peptides. That's a new thing.
Oh yeah, 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 yeah. I like peptide. Oh, by the way, that brings up an interesting. So I recently had a follistatin shot. Do you know what that is? Have you ever heard of follistatin?
Follistatin.
It's a
No.
peptide. Okay, so
Oh, okay.
but follistatin, okay, normally our bodies produce it when we're young, like teenage years and stuff, and it grows muscle. It's protein synthesis. It grows your muscle and it encourages fat loss, basically,
Okay.
and it's anti-aging as well. So most people do it as a peptide. They'll inject it, but there's this company called Mini Circles that I don't know if you've heard of them, but it's a genetic therapy where they actually they splice in the gene to produce the follistatin in your own body. So they use a plasmid DNA from a bacteria, and
Huh.
they put the follistatin gene in that plasmid DNA, and then they give you an injection,
Huh.
and it goes into your cells. It doesn't interfere with your body's own DNA. It stays within the cellular matrix, and it will reproduce the follistatin for 2 years after you get the shot.
Interesting. I
Yeah.
got to look into that. Send me
Yeah.
the data on that.
Yeah, it's really interesting. I went to this biohacking event. It was in February, and all the guys like, Ben Greenfield, Dave Asprey, all those guys were there. I didn't even know what this event was about. I just got invited, and the main topic was this follistatin. And it just so happened that, and this is a fantastic story too, by the way, because it just so happened that the CFO of the company, we were already in communication before I came to that seminar, and he came up to me and he's like, "Hey, Dr. Harari." He knew me just because we had already been communicating through WhatsApp, but I didn't know who he was. And then he introduced himself, and then he tells me, "I need to do a trade with you guys," because he had lost so much weight with his follistatin shot. He weighed 350 pounds, right? And he
Oh,
got the
wow.
shot. He lost I think it was 150 pounds. Kid
You
just
sure
ripped it off his body in like
you
6 months.
didn't inject him with Ozempic?
No, this was from the follistatin.
Okay.
Yeah, anyway, so what happened is, because when you lose that much weight in that short a time, you end up with folds, like skin folds, right? So he had to have surgery to repair pull that skin up. But the problem is his body, every time he'd do the surgery, he'd get these little like infections in the where they put the sutures or whatever. He had to go back 12 times
Oh
to
my
keep
God.
repairing, right? And so he was like, "Listen, I got to do some major biohacking. I want to do a trade because this follistatin shot's not cheap. Yeah, it's only given outside the country. It's not legal yet in this country."
Okay.
So, and anyway, he's like, "Listen, I want to do a trade with you guys." So, because he knows what we do in our clinic, and
Right.
so he came in 2 weeks prior to the surgery. He did all the therapy, did red light, hyperbaric pulse, and a few other therapies we got. Anyway, he went in that surgery, came out, kept doing the treatment, had zero problems post surgery. Whereas previously, every single time he had systemic infection. So
Interesting.
that was amazing.
Cool.
Yeah.
What about cancer? Can these therapies be used as adjuncts to cancer care?
Yeah, I would definitely say as an adjunct. I would not say by themselves as a cure or a treatment even. It's more like supporting the body's natural immunity and detoxification. In that regards, I think they can be very helpful. I've seen cases of patients that were in hospice. Specifically, I had this one guy, he came in, he was actually in a coma. He had a brain tumor. And his wife was like really insistent that he get the care. And so we brought him in a wheelchair. He was literally in a coma, and we put him on the pulse bed. Yeah, this is a crazy story. This guy's 90 years old, right?
Oh,
and we put him on the pulse bed, and he wakes up out of the coma.
really?
Yeah.
Wow.
So he started coming in and getting regular care, and he lived. They had given him previous, like, I think 2 weeks to a month, maybe. Like, he was in hospice care, right? He lived another 4 months, and he was completely communicative with his wife. He was able to enjoy his life up to the last moment.
Cool.
Without being in a coma.
That's great.
That was an interesting one.
Dr. Harhari awakes the man from a coma.
That was crazy. That was really crazy. But no, I had another patient, though, that, oh my God, this is a wild case. This is the case for the medical journals. This woman came to me from Iowa. She was the wife of a farmer, and she had, where the town where she lived, they did glyphosate spraying, for decades.
Sure. Yeah.
And she told me that pretty much everybody in the town died from cancer where they lived.
Right.
She ended up getting cancer, and she had pancreatic cancer that had spread to her liver, and it created a tumor that was, and I'm not joking, dude, it was the size of a 9-month pregnant woman. That's how big her tumor was. It was huge. And she was, they had her on morphine. She was basically in hospice at that point. And she was like, I just want to live. He goes, I just want to live. I'll do whatever it takes. And I'm like, okay, well, I mean, the medical doctors had just written her off. They'd put her on morphine, and it was it. It was done. And so I said, okay, let's see what we can do. So I actually had her, and this was without much knowledge at the time. There is more data now, but I was getting into the Wim Hof method, where, getting into ice water.
Okay.
And so I said, listen, this is what I do every day. I think you should do it. And so she did it. She got in the ice water. Very first time I met this woman, and she started doing 11-minute ice baths, 32-degree water every day.
Huh.
Every day. This woman was determined, right? And so I had her doing the pulse. She was doing ozone therapy. She was doing Rick Simpson protocol with, cannabis and, a million. I had her on like at least 10 different therapies, right? And in 2 months, her tumor had literally broken apart and shrunk down by 2/3. Huh. And she was off the morphine. She got off her morphine. She had all her strength back. She could barely walk when I first met her. She walked away after I saw her. She was carrying 2 50-pound suitcases. She was strong, like an ox.
Huh.
Unfortunately, though, I couldn't keep treating her because she had to go back to Iowa. I had another thing I had to do. Anyway, but she did get 6 more quality months of life, which she would have not otherwise had. So that was quite amazing to see that. I think if I'd probably stayed with her, 6 months, we could have seen a complete remission, maybe. We'll see.
Okay.
But that was exciting to see that kind of progress with somebody. It was amazing.
Cool.
Yeah.
Okay, so what else you got for us?
Well, the other biggie that I'm really into is the StemWave.
It's StemWave?
StemWave. That's shockwave therapy.
Oh, okay.
Are you familiar with that?
I am.
Yeah, so I've been using.
It's like a high pressure sort of compression massage type device.
Yeah, exactly. The one we use is called a StemWave. It's a true shockwave. There's different types of machines on the market. They're all good to some degree. They do different things, but the one we have is it's really deep. Like it.
Is that the name of the company, or?
Yeah, it's called StemWave. That's the name of the company. But it's an electrohydraulic machine, meaning it's running the shockwave through water. So the head has water in it. And so when that shockwave hits the body, it's traveling at 3,355 miles an hour into the body.
Okay.
So it has a massive stimulatory effect on healing joints. So I do mostly joint rehab with that machine.
Okay.
We had about 6 or 7 people in the last year that avoided different types of joint surgery, shoulder surgery, back surgery, hip surgery, or recovered from. I mean, we had some people that had really bad fractures that it helped in their recovery, post surgery. But that therapy is to me as a chiropractor is a godsend, because I'm able to help people with bad knees, bad hips, low back disc problems, neck. I had one guy who was scheduled to have a disc replacement, C6, C7. After 2.5 weeks of doing the therapy, he had no more symptoms. The symptoms went away.
Cool.
They canceled the surgery. So that was beautiful. Yeah.
That's great.
Yeah. It's fun stuff.
Okay, cool.
Yeah.
So, how can our listeners find out more about you and connect with you at your clinic?
Yeah. They can go to HEAL.com. That's the website.
Okay. And you're in which part of Los Angeles?
We're like South Beverly Hills, like Robertson, Pico neighborhood.
Okay, cool.
Yeah.
Great. So thank you so much for joining us.
Yeah, it's my pleasure. I think we have a lot of friends in common too, by the way.
Do we? Who's that?
Yeah. I mean, what's your what's the woman's name? She's a holistic psychiatrist.
Hyla Cass?
Hyla, yeah.
Oh, okay.
She does stuff with you. Yeah.
Oh, okay, yeah.
I'm friends with her. I've known her for a long time.
Oh, okay. Yeah, I've known her for a long time too. She's kind of a little bit of a mentor to me.
Yeah.
I organize these functional medicine discussion group meetings where we bring in speakers. You're welcome to attend. I'll add your name to the mailing list.
Awesome. How often do you do those?
Well, we've been doing them every month. I think we might go to every other month because since the pandemic, the turnout hasn't been as good. But we have Dr. Pimentel joining us in January.
Okay.
So we'll be having a discussion about SIBO and IBS.
Sweet. I'd love to come and check.
Okay. Sounds good.
Awesome.
Okay.
Well, thank you for having me. It was
Thank
awesome.
you.
Okay.
Thank you for making it all the way through this episode of the Rational Wellness Podcast. For those of you who enjoy listening to the Rational Wellness Podcast, I would very much appreciate it if you could go to Apple Podcasts or Spotify and give us a 5-star ratings and review. As you may know, I continue to accept a limited number of new patients per month for functional medicine. If you would like help overcoming a gut or other chronic health condition, and want to prevent chronic problems and want to promote longevity, please call my Santa Monica White Sports Chiropractic and Nutrition office at 310-395-3111, and we can set you up for a consultation for functional medicine. And I will talk to everybody next week.